Just a little bit about the bio, my bio. I'm a physician who's been practicing since 1990. I have been part of Regenex since 2012. We've received Best Doctors Awards for 4 years in a row. And I also am a cyclist, and I've had numerous Regenex procedures to keep me going and to keep me active. And these are my colleagues. On the left is Dr. Mark Adelsheimer, and on the right is Dr. Jess Sally. Again, we're all board certified physicians in physical medicine and rehabilitation. And we've done lots of procedures since 2012, over 3,000 stem cell procedures and 15,000 platelet-rich plasma procedures. We evaluate you and treat you from the beginning to the end of treatment. So tonight I thought I'd have some fun with Regenerative Mythbusters. So the first myth is Regenerative doesn't matter. We're the first and largest provider of orthopedics for musculoskeletal use in the world. The Chief Medical Officer, Chris Centeno, is recognized as the authority in the regenerative field, and we've provided more PRP and stem cell treatments than anyone else in the world. So Regenerative is a specialty of interventional orthopedics. We use needles, not scalpels. We use new medically less invasive procedures. We have a highly selective physician network, and we provide a lower risk alternative to surgery. We're the world's leader in research and development, and we have a nationally self-funded employer practice. So the first myth, or the second myth, is doctors don't matter. And my question is, why not have an expert in the field rather than a nurse practitioner, a chiropractor, or a physician's assistant perform your procedures and assess you from beginning to end? We have specialized training in this field that makes a significant difference, and Regenerative has the best trained board-certified physicians in the country. Next myth, education doesn't matter. It certainly does. We have numerous physicians that are board certified in orthopedics, physical medicine, rehab, sports medicine. But in addition to that, we go through routine, rigorous training at Regenerative and the Interventional Orthobiologic Foundation so that we can treat patients consistently and continuously throughout the course of time. And when research indicates the need for change, we make those changes. And here in Pittsburgh, all of our physicians are Interventional Orthobiologic Foundation certified at the highest level, master's level of competence in all areas of musculoskeletal treatment. And it's tough to get in the Regenerative network. You have to really strive to be well-trained and recognized in the field before you can get into this network. It's very exclusive. Next myth, diagnosis doesn't matter. Yes, it does. Yeah, if you don't make a correct diagnosis, and doctors are typically diagnosticians, then you're going to miss the diagnosis about a third of the time, and you'll perform the wrong treatment as a result. So making the correct diagnosis matters. Next myth, doctors never spend any time with you. We at Regenerative spend lots of time with you. At our initial evaluation, we spend an hour examining you, looking at your diagnostic studies, performing an ultrasound, exam and going over the treatment routine, we give out our cell phone number to all our patients. We want to stay connected with you throughout the course of treatment and for years thereafter. Experience doesn't matter. A myth, it does matter. Regenix, of course, started in 2005 and has the most experience in the field of orthobiologics. And Regenix Pittsburgh has been treating patients since 2012. Again, we've performed over 3,000 bone marrow concentrate stem cell procedures and 15,000 PRP treatments since that time. We've performed more treatments than all of the other regenerative networks combined here in Pittsburgh. Image guidance doesn't matter. Yes, it does. You need to put the orthobiologics in the precise location with image guidance, whether that be ultrasound or fluoroscopy. You can see them down in the right-hand corner in order to get an optimal result. If you just shoot the orthobiologics into the knee, they're not going to adhere to the injured tissue as well, and the results will be suboptimal. Dosing doesn't matter. Well, it does matter. We use a laboratory rather than a bedside centrifuge. You can see down in the right-hand corner, one size doesn't fit all. We're providing specialized dosing of your orthobiologics based upon your individual needs. We treat tendons, ligaments, and joints, and they all require specific doses of bone marrow concentrate containing your stem cells and platelet-rich plasma in order to get an optimal result. This is a myth that often is perpetrated. My stem cells are too old. They are not. You have plenty of cells to treat somebody's large joint effectively. And in fact, last night we were talking about my colleague, Dr. Adelsheimer, treating a 98-year-old patient's knee, and he did quite well after that. Importantly, embryonic, placental, cord blood, and Morton's jelly are tissue products. They contain no stem cells, and the FDA considers them to be illegal. My joints are degenerated. This is a bone-on-bone joint. Bone-on-bone treatment is what we do, particularly for older folks that their joints are worn out. And the stem cells work very well in this area. Most people do very well, and they can get years of relief. And 87% of people who are told that they need a joint replacement have the stem cell treatment and wind up not undergoing a joint replacement. And this lasts for years and years and can be repeated. The FDA doesn't care and doesn't weigh in on the matter. Yeah, they do. They pay a lot of attention to this area, despite the fact that we are not either a device or a drug regulated by the FDA. And in fact, Regenix offers the only treatment of bone marrow concentrate which the FDA considers to be compliant. We use only your cells, and therefore they can't be rejected or cause infection. And additionally, cells from fat are illegal and considered by the FDA to be making a drug. So let's talk a little bit about platelet-rich plasma. It contains growth factors and other things that amplify healing. It's like giving an espresso shot for a local repair by using these growth factors, and it makes the PRP work harder and longer, and in conjunction with stem cells, makes them work harder and longer as well. Stem cells work in several ways. They act as the general contactor for a repair job. They tell other cells what to do and how to repair the damage. They also use the espresso shot factors, growth factors from PRP effectively. And stem cells are pluripotent, which means that they can turn into cartilage, ligament, tendon, and bone. So which one is for you? Platelet-rich plasma typically is for folks that have less degeneration, mild degeneration, smaller joints. They work well in ligaments, tendon, and we use it almost exclusively in treating spine. Bone marrow concentrate for larger joints, more damaged, moderate to severe osteoarthritis, and we use it inside the bone to heal the bone from the inside out. So research doesn't matter. Well, it does, because without research, you're literally taking a shot in the dark. Regenix has completed 40% of the world's literature on stem cells, and our registry contains tens of thousands of patients who have undergone these treatments. You've got to have the science and the consistency to know what works in order to make it better over the course of time. Orthopedic treatment is the only option. No, it isn't. Here at Regenix, we're the trusted alternative to orthopedic surgery. 80% of all orthopedic surgeries have not been proven to work, and in some cases, such as meniscal surgery, can quicken the demise of your joint. Our treatment is done with needles, not scalpels and saws, and as such, it's considerably safer. We have no large complications like death, like blood clots, like significant infections. And more recently, orthopedic surgery has been shown to have negative cardiac effects in about 10% of the cases. So the message is, let's stop cutting things out and inject biologic agents that can help tissues heal. So in the cases of meniscal tears, you're just hastening the demise of that joint and speeding up the onset of arthritis. And this is true of a number of the orthopedic surgical procedures that are still being done. Regenerative treatments are limited. We can treat more areas of the body that are orthopedic or neuromuscular than any other entity doing this work in the world. And we treat spine, but cervical spine, we treat sciatica, spinal stenosis, we treat hands, wrists, elbows, toes, and fingers. We treat knees, and we can repair anterior and posterior cruciate ligaments. We treat shoulders and can repair rotator cuffs. We treat labral tears in hips, and we treat things like plantar fasciitis, bunions, etc. So we treat it all, really, from the tip of your top of your neck to your big toe. And one size doesn't fit all. At Regenix, we individualize your treatment to suit your needs and address your condition. We'll always offer you the optimal treatment possible. We have an on-site lab. Our intellect as physicians, our skill and experience of 10 years of doing this enables us to dial in the right treatment for you most of the time. These treatments are not safe. They're very safe. We have a safety paper of 2,500 patients strong to prove it. It shows that these treatments are extremely safe. There's 1 to 3 days of downtime. There's a very low risk of complications. The most common complication was pain at the injection site that lasted for a few days. The infection rate is 0 for us. I have to be off work for a long time. In many cases, we can get people back to work the next day. If you're a heavy laborer, maybe you'll be off work for a couple weeks. But in most cases, you're back to work within the week. In contrast to a similar orthopedic surgery, you could be out for months. So we get you back to your daily routine, back to your work, back to your leisure activities much more quickly. So I have too much wrong and I'm likely a poor candidate. Well, most people are good candidates, but if you let things go for a long period of time, like the knee example in the middle, you have what's I term as the leaning tower of Pisa condition. Pretty soon you're going to topple, and at a certain angle, beyond about 10 degrees, that becomes a problem. So that's an issue. Having recent cancer is an issue, and having multiple medical conditions or arthritis all over your body can make you a poor candidate. But most people are good candidates, and we can help them. We don't treat the entire person. Yes, we do. We look everywhere to understand your biomechanics and why your shoulder is down and your hip is up, and why you have pain down your leg when you're complaining of knee issues. We're very adept at understanding why the hip is connected to the knee, is connected to the ankle, etc. And we're going to look all over, doing a comprehensive examination to make sure that we're not missing issues related to your overall musculoskeletal health. Only young athletes can have these treatments. Well, we treat world-class athletes, but we also treat mostly weekend warriors who are elderly, who want to play golf, who want to garden, who want to just go out and walk. So this treatment is really for everyone who wants to get back in the activity that they love. Taking bone marrow out of my pelvis is going to hurt. No, it's very unlikely. Our technique is so refined that you will likely experience no pain during the procedure, with the exception of removing the marrow, where you may experience a deep ache. The discomfort is typically gone within minutes to maybe a few hours. And this is just an example of that, where a person is undergoing a bone marrow aspiration under ultrasound. And as you can see, she's really very comfortable and not flinching. We use skinny needles, and we use a high-speed drill. It takes literally a second to get into the posterior pelvis, and that's all there is. It's safe and effective. So most people, will I ever be able to return to my active lifestyle? About 80% of those folks that are treated are able to do so. It does take time for healing to occur, and so it may be weeks to months before you get back to the things that you love. Physical therapy helps, and we encourage it to strengthen muscles, stretch soft tissue, and restore function. Also, we brace knees for a short period of time to help the stem cells that we inject grow. These treatments are way too expensive. They are expensive, and insurance doesn't usually pay for the regenerative portion of the treatment. But 80% of what we do is platelet-rich plasma, which is much less expensive than the 20%, which are stem cells. You have to think about this as a whole. With copays and deductibles, you may be wind up paying more. And with the minimal time you miss away from work, as opposed to an orthopedic procedure, you may be losing a lot of money. So there are many ways to look at this, but it turns out if you look at it totally, you may actually be saving money, though you're paying out of pocket. So the pre-injection is the first in the stem cell protocol. We do 3 days of treatment. The first is tilling the soil, which stimulates the inflammatory response in your body and allows these stem cells that are going to be injected to heal. We use a dextrose solution. Most people leave having undergone this treatment feel a whole lot better. It's usually done under ultrasound guidance. It takes about a half an hour typically. And beginning the second part of treatment, we do the bone marrow aspirate that I showed you, getting the bone marrow out of your posterior pelvis. It's the source of your stem cells. It's concentrated on site in our lab, and it's re-injected back into damaged tissue the same day, and then you go home. And there's about 2 hours between the harvest of your bone marrow and the implantation. And this is the planting the seed phase. It's 2 to 4 days following the pre-injection. The aspiration of the bone marrow is rated as a 3 to 4 out of 10 on the pain scale, because it can be slightly uncomfortable when you're taking the marrow out, but the rest is painless. We send it for lab processing in our lab and re-inject 2 hours later. And then the third treatment is fertilizing the seeds, stem cell seeds, 2 to 3 days following the stem cell injection. We use platelet-rich plasma, which is injected. It requires a blood draw and waiting about an hour to an hour and a half to get the platelets out of the blood. And again, we use the lab processing in our office. And the re-injection typically takes minutes. Again, everything is done under guidance, whether it be X-ray fluoroscopy or ultrasound guidance. So, and those are the 3 steps that make up the stem cell treatment that we provide to patients, and it's very effective. So who is this for? Well, it's for people who want to avoid surgery, keep all their body parts. They don't have time for lengthy downtime or lengthy rehab. They want to get off their drugs. They failed surgery before, and they know someone who's had a bad outcome. They have a medical contraindication for surgery, or they're too young for surgery. We see young folks who have torn their anterior cruciate ligaments and want to get back to their sports, and we're able to help them out. We have the results are a good outcome. There's less pain, increased function, improved mood. You're off your pain medications and you're back to your preferred lifestyle. So for those of you who want to get your life back, enjoy your family, get back into the fun of life, get your finances back together by getting back to work, restore your fitness, and improve your relationships with your loved ones. This works nicely for you. So the next steps, there is no referral necessary. If you have imaging, you can gather it. We'd like to see pictures and go over the pictures with you, MRI and or X-ray. If you don't have it, we can write for those studies. You'll call the Regenetics liaison. You'll go to an appointment or a telemedicine appointment. And if you're a candidate, you're going to get treatment. You can rehab at home or go to physical therapy, and we get you back into that life that you want. So we are all physicians are master certified in all areas of treating the body. We've gone through rigorous training with the Interventional Orthobiologic Foundation to achieve that status. So we're good at this. We're all local doctors. We're Pittsburghers. Again, we have extreme specialty training, so we really know what we're doing and know how to make the right diagnosis. And the training doesn't stop. We go back to Denver and train and train and train some more. We're going to obtain imaging and go over your imaging. We do in-office ultrasounds. We show you what you've got, and we tell you how we can fix it for you. Step 2 is get an examination. We've talked about this. It's about an hour-long exam. We take a comprehensive history and do a comprehensive physical exam. We're going to go over your diagnostic studies with you, review your written history if you provide outside source for history. And perform an ultrasound examination. We don't do ultrasound exams on the spine, but on peripheral joints we do. We're going to talk about what it is we're going to do, and you're going to get your questions answered. We will answer all your questions before we depart. And if you have this procedure or platelet-rich plasma or stem cell procedures, you'll have our cell phone number in case you need to get in contact with us. So get treatment. There's little to no rehab. There's minimal to no pain meds, minimal to no missed time at work. You're going to get your life back sooner than rather than later. And you want to take your health off hold today. You want to avoid the surgery backlog and worsening of your condition. If you have the leaning Tower of Pisa knee, the angle can get to the point where you're no longer a regenerative candidate. You're going to get your fitness back and get your weight back to where it ideally was. We're going to improve your quality of life and enjoyment of loved ones. And remember, no one's getting any younger, so don't wait. Insurance most often covers the consultations, the follow-ups, the diagnostics, the bracing, and the physical therapy. As I said previously, it doesn't cover regenerative procedures, the prolotherapy, the PRP, platelet lysate, and stem cell treatment. Again, with copays and deductibles, you may actually wind up paying more than for traditional orthopedic surgery. And remember that we customize treatment plans for you. One size really does not fit all, and there is a wide price range based upon what it is that you need. And we will tell you specifically what we think the best treatment for you is. So you can contact Sarah Ferland. She's our Regenix liaison to schedule an in-house or phone consultation. 412-963-6480 is the phone number. And she's very good at getting people on our schedule so that we can see you promptly, make a determination about what it is that you're going to need. So Regenix, avoid surgery, reduce downtime, and get your life back. I mean, life is about enjoyment. So you want to be able to enjoy life as much as possible, particularly if you're older. So that's pretty much it. I see that there are a number of participants. I'm going to take questions now. I only see one question. What does a low risk of complications mean relative to surgery, relative to flying, or are there numbers for this? I'm not sure if I understand relative to flying. There is a low risk of complications. The people don't get infections. We've had a 0 infection rate. We've had a few blood clots, but since we instituted a blood clot protocol, nobody has had a blood clot. I think the incidence of blood clots prior to this was about 1 in 1,000. As far as relative to flying, I'm not sure if I understand that. So unless you're talking about blood clots when you leave, you can come in and get on a plane at the end of treatment. I have no issues with that. Unlikely for you to have blood clots even if you're flying, but we recommend support stockings for people who have had lower extremity treatment for about a week following the treatment. Next question, what's the success rate for tendonitis of the left posterior tibial tendon? If the tendon has not ruptured, it's likely that with treatment, depending upon how bad the tendonitis is, that we can get it restored with platelet-rich plasma, not with stem cells. It may take 1 or 2 treatments for this to be effective. We're going to want to look at your medial arch because your arch may have fallen, and we want to treat your foot comprehensively. We also will look at your spine to see how your L5 and S1 spinal nerves are supplying the muscle tendon. That may also be an area to benefit treating you more comprehensively. So that's how we would treat you. And usually we have about an 80% success rate treating that. Next question. I have bone on bone in both shoulders. Would you work on this? I have had steroid shots and pain-free for 2 months. So we typically will wait 6 weeks following steroid injections to treat you. If you have bone on bone in both shoulders, we're going to want to use stem cells rather than platelet-rich plasma. And yes, we do treat you. If you have limited range of motion, we'll attempt to restore that range of motion prior to giving you a stem cell treatment with a treatment that we do called capsular distension, where we put a large volume of a low concentration biologic called platelet lysate into your shoulder and work on some range of motion activities once we've injected this, and then proceed with stem cell treatment. Again, I don't know how your rotator cuff is, and that certainly would be an issue to address. I'm going to try to see if I can see the rest of the questions here. They're coming up. How long is physical therapy after stem cells on the hip? Can you rehab yourself, or do you need to go to physical therapy? So the answer is we like people to go to physical therapy, but we don't want them just to do modalities. They need to work on restoring your range of motion and restoring your strength. And once you've gotten that down pat, you could do it at home or do it in a gym. So that's true for any joint that we're going to work on. For spine procedures such as lumbar prolotherapy or other spine treatments, what's the risk of nerve damage? Does the injection lead to other long-term damage or piercing tissue, or does that heal? So the answer is that treating the spine is typically something that we do comprehensively. We do a platelet lysate prolotherapy, which has some dextrose in it, where we're treating the ligaments of the spine. We'll treat the deeper muscles along the spine with platelet poor plasma that has A2M in it. And that's alpha-2 macroglobulin, which is an interesting standalone treatment in and of itself. We'll treat your facet joints with high concentration platelet-rich plasma, which we call super concentrated PRP. Typically, we use 20 times normal concentration in facet joints. And then we'll treat your nerves with platelet lysate. And if I haven't talked about platelet lysate, Platelet lysate is your platelets concentrated, frozen, ruptured, filtered, and it's pure immediate release growth factor, which is great for nerves. And it works very well on disc bulging and tears also. So all of those things work in concert to get your spine back to optimal function. And if we have to, we can go into your disc also. So that's an alternative. But usually we try to stabilize the posterior elements first. So let me see what other questions we have. The next question, several questions. Can the stem cells regenerate cartilage in the hip? The answer is yes. If your hip is massively degenerated, then you're gonna have grow a little cartilage. I just recently saw somebody who had end-stage hip disease, and after treatment, it appears that the space in her hip has improved. So the answer is yes, but the main thing that the stem cells and platelet-rich plasma will do is change your condition from one of breaking down to one of rebuilding. And that's really how help is optimally occurring. Sometimes we do put cells into bone, particularly with significant degeneration. We'll go ahead and inject bone marrow concentrate because the bone marrow lesions that we see in all the large joints and sometimes in the small joints represent microfractures, and so we're healing those fractures with stem cells. How long do stem cell treatments in the hip last? So you can get years and years out of the treatments if you're considered to be a reasonable candidate. Hips are the toughest if you're older than 60 and you have limited range of motion. We consider you to be a poor candidate. Poor basically meaning that your chances of doing well are around a third. Some people like those odds. They'd rather take those odds than undergo a hip replacement. But we'll tell you when we see you and look at your diagnostic studies whether what kind of candidate you are. Next question, how long does PRP treatment in the hip last? So if you have mild hip osteoarthritis, it can last a couple of years. If you have severe hip osteoarthritis, it's going to last less than a year. It doesn't work nearly as well as stem cells do on moderate to severe osteoarthritis. Drilling into your bone marrow be dangerous? So the answer is, can it be? Theoretically, yes. I think that if you're well trained at this, it's not dangerous. I think that the overall rate of complications for bone marrow aspiration are less than 1%, whereas adipose aspiration is slightly higher than 1%. So in our hands, this is not a particularly dangerous treatment to either drill into bone to aspirate the bone marrow. And we've really found an optimal way to make it as pain-free as possible with a drill as opposed to a large trocar, which is much thicker and much more demanding when it comes to getting into your pelvic bone marrow. So with the bone marrow drill, as you saw, it was pretty easy for this young lady to tolerate, and that's our experience virtually all of the time. So I'm glad to answer any more questions if you have them, and stick around for a while. We've spent about 40 minutes together tonight, and I've appreciated the opportunity to address questions for you. There are some more, so let me look. How long does PRP therapy last for people over 60 years of age? The answer is it lasts the same length of time as for people under 60 years of age. Your PRP is viable. It has time-release growth factors and does a good job for mild osteoarthritis. For people who have like Achilles tendonitis, plantar fasciitis, or in your case, posterior tibial tendonitis, it's likely that with 1 or 2 treatments, you're going to have a permanent fix, that you will be good and continue to be good. But again, it may be beneficial to treat your L5 and or S1 spinal nerve in your back, and it certainly will be worth your while to have your arch rebuilt with platelet-rich plasma, as long as we're just addressing the tendon. Otherwise, if we don't help your arch out, this tear may occur again. So we really need to think of you comprehensively. So I've had a lot of treatments over the years, much more than either of my colleagues. I'm almost 70 years of age. And I've had probably 5 treatments with platelet-rich plasma in my left knee and 3 treatments in my right knee. I've had my thumb joints injected, my elbows injected, my ankle injected with stem cells, my knee injected with stem cells. And they really worked fabulously. Case in point is I'm a cyclist, as you saw at the beginning, and my bucket list I'm almost age 70. I probably should say I'm a little over 69, but I'm about 69 and a half. And I went and rode the Alps this summer with my younger brother and our 2 wives. Women were on e-bikes and we were on regular bikes, and you know, it's a great thing to be able to do. And truthfully, I can't imagine having not had regenerative treatment and being able to do this. So those are the things that I've had done. I've also had my back worked on several times. I forgot about that. So I've not had treatment in my neck, but I've had my back treated. I've had my shoulder treated twice as well. So lots of stuff to keep me going. And as you get older, that's what happens. Your parts tend to get worn, particularly if you're enthusiastic about doing athletic activities. Let me see if there's another question. Did I do better with stem cells versus PRP? So I did fine with PRP until I didn't. In other words, I tried platelet-rich plasma 4 or 5 times in my left knee, and then I decided that I really needed to go to stem cells to treat me effectively in my knee and in my ankle. I had tried PRP in my ankle as well, and it didn't work as well as I would have liked. So that's what made me decide to go to stem cells. And you know, I'm a person who likes to function at a high level. So if I get much below 90% function, and if it starts being painful, I just do more regenerative treatment and to keep me going well. So I hope I've answered your questions. Again, I can stick around for some more time. I'm happy to talk with you and communicate with you as it relates to all of this. It's amazing, amazing stuff. I find the treatment that I do on my patients to be incredibly gratifying, to see them really blossom and get back to the things that they love. I do want to let you know it doesn't work for everybody. We think that it works for most folks, but we don't say we have a 98% success rate, because it's not true. Typically, 2 out of 3 people do well. Typically, at about 4 weeks, you're really starting to improve. At 3 months, a lot of the work has been done. At 6 months, we expect you to be 75% or more better if you've had a positive response to treatment. And again, there are people that don't respond positively to treatment. Hips take a little longer. They're sort of in the 6 to 9 month range for optimal regeneration. So best of luck to you all. I would be happy to see you in the office. Remember that it costs nothing to be evaluated by us. We'll spend an hour with you. Typically, your insurance company pays for the initial evaluation, and we will be happy to formulate a treatment plan for you. So another question: how much is stem cell treatment for the hips? Treatment for the hips can range from about stem cell treatment can range from about $7,000 to $8,000 to over $10,000, depending upon whether we're drilling into bone to treat bone marrow lesions or avascular necrosis. Platelet-rich plasma, on the other hand, is less than $2,000. I think somewhere around $1,500. Again, we're going to treat you comprehensively. We're going to treat your ligaments to stabilize your joint, treat the muscles that attach to your trochanter, in addition to treating your intra-articular space. If you have labral tears like my patient today, we will treat those labral tears specifically, placing the needle within the labral tear to treat it. Small tears can be treated with platelet-rich plasma, larger tears with stem cells. Question: can you get worse after treatment? Can it degenerate? The answer is yes. Unlikely for that to happen, but it does happen. I would say it happens in less than 1% of the cases. Hips may be a good example where you can potentiate degeneration in the hip by treating it, but it's highly unusual to occur. These are areas that typically respond very well to treatment, so an unlikely possibility, but it can occur. So again, thank you very much. I'm thrilled that you were able to spend this time with me, and hopefully I'll see you in the office. Call Sarah Ferlin at 412-963-6480. Bring your diagnostic studies. If you have records from someone who's treated you, we're happy to see that. We like to review actual diagnostic imaging and go over that with you. So take care. Have a great night. It's been a pleasure to be part of your hopeful regenerative process. Thanks again. Be well.